basically, my argument with regard to both of these bills, but I'll get into a little detail, is one with regard to the public health emergency. I think that this bill is unnecessary. I mean, I think it was the gentleman from Texas that mentioned earlier that in his statement with regard to this legislation, the president has said that his current plans are to end the public health emergency on May 11th. Clearly, he has envisioned what needs to be done here. But my point is that this should be an executive decision. In other words, under the public law, this is a decision that is made by the Secretary of Health and Human Service, advising the president, because it should be based on science. It should not be based on, what Congress feels is necessary. I want to take away from Congress, but like with anything that comes before the Energy and Commerce Committee that deals with health care, oftentimes we defer to the executive because we don't have the science behind us. There have been times, as you know, Ms. Chairman Rogers, when members, for example, want us to adopt protocols for a particular disease. And I say, well, that's crazy. I can't determine protocols for a disease. I'm not a doctor, right? And I feel the same way about this, that it's just not appropriate for us. That's why the public law leaves it up to the HHS and ultimately the president, because they have the information. And so we shouldn't be substituting that. And as I said, the president has already said that this is likely to happen on May 11th. Let that unfold. Let us not interfere with that, because we know that when the public health emergency ends, that certain things change, right? And you mentioned some of them. In fact, when we did the omnibus bill at the end of the year, we did certain things with telehealth. We did certain things with Medicaid. We did certain things that we thought were necessary, but it's not. But those things were not of a scientific nature, in my opinion, like ending the emergency based on whether or not this particular disease is still with us and needs to be attended to. So let me just say, I mean, you understand that this bill would end the health emergency immediately as soon as it's enacted. Now, I don't think it's going to be enacted, but I mean, the bottom line is that it would just be abrupt. That's it, right? As soon as it's enacted, that's it. And the fact of the matter is that when we did pass the end of the year omnibus to wind down or extend certain authorities related to Medicaid and Medicare and telehealth, we did that because we didn't want to disrupt insurance coverage for millions by undoing the important bipartisan agreement, such as to wind down the continuous eligibility requirement that's kept beneficiaries continuously enrolled in Medicaid throughout the pandemic. We also had strong guardrails in place to ensure that beneficiaries were protected from inappropriately being kicked off Medicaid as states resumed conducting eligibility determinations. But all these things are eliminated. In other words, if the public health emergency ends on the day of enactment, say, 2 weeks from now, right, then all those things end. All the things that you mentioned, Chairwoman Rogers, end. And we're just left in a vacuum. I mean, it doesn't make sense to me. Rather, what you should be doing is figuring out what needs to be continued, how to wind this down. Americans would immediately begin paying out of pocket for COVID-19 testing. Hospitals would see an immediate payment cut of 20% for Medicare patients with COVID-19. Providers and state Medicaid programs have relied on important waivers and flexibilities for the duration of the COVID-19 pandemic that would be terminated immediately as well. We have all these tools. We have tools for dealing with outbreaks in nursing homes and other residential facilities. We have our veterans for VA clinicians, ability to prescribe controlled substances via telehealth. That would end. It would abruptly end flexibilities for SNAP, for the Supplemental Nutrition Assistance Program. I mean, I could go on and on, but the point I'm trying to make is that it really should be left to the executive, not the Congress, to make these decisions, because they're best positioned to make this determination as intended under Section 319 of the Public Health Service Act. And I just think that it's critical that we provide time to wind down all of these protections that we put in place to fight the pandemic, and to just immediately end it all abruptly without thinking about this, I think is a mistake, and I oppose the bill. And frankly, I do think that since the president has indicated that he plans to do this by May 11th, that gives us the time to deal with all these things rather than just say, okay, on the day of enactment, that's the end of it. Now, as far as the vaccines are concerned, I'll try to be brief. I promised to be brief, and I guess I wasn't. But again, I do want to say, my colleague, Chairwoman Rogers, mentioned regular order at some point. And I know how many times, Chairman Cole, I've come here and, you or she complained about lack of regular order in the last Congress on certain things. But I mean, this is like the biggest avoidance of regular order I've ever seen. Dr. Burgess, you always mention regular order. But keep in mind, this bill wasn't even thought of until a few weeks ago, right? In other words, well, maybe it was thought of, but I mean, we had nothing. In the Energy and Commerce Committee, just so all of you know who are new on the committee, what we do is a bill's introduced, it has a hearing in the subcommittee, then it's marked up in the subcommittee, then it goes to the full committee, it's marked up in the full committee. We have a regular process, that's our regular order. None of that has happened here on either of these bills. Now, I know you're gonna laugh and say, well, sometimes that happened when we were in the majority, but it didn't happen like this on everything that's coming for us, Dr. Burgess. I mean, you're the biggest one that would always complain and be about lack of better order. And you've got these 12 bills that were part of the rules package. None of them went through regular order. And these are very important pieces, but whatever. I don't want to just talk about the process. I want to talk about the vaccine mandate. This is very, well, I mean, a little bit. The vaccine mandate was put in place because it was understood by most healthcare professionals, again, the science, the doctors, the nurses, that it makes sense to have healthcare workers vaccinated, because if they're not, then it's more likely that they get infected, the people that they're helping get infected. And there's all kinds of evidence, and I'll just cite a little bit of it because I don't want to take up too much time, that by doing that, we prevented people from dying and getting seriously sick, both the healthcare workers as well as the people that they were taking care of. And if you just say we don't need the mandate anymore, I think that's going to be reversed. So let me just give you some indication. New deaths among nursing home residents decreased by 83% once vaccination efforts began. And a 10 percentage point increase in staff vaccination rates resulted in fewer COVID-19 cases among residents and staff and fewer COVID-19 deaths. Vaccination of healthcare workers has protected the workforce and saved lives. I mean, some statistics, it ensures that patients continue to get the care they need by preserving resources and ensuring that doctors and nurses can continue to provide life-saving treatment. If you don't have the vaccinations, you're going to have less of a workforce. In fact, since we put the vaccination mandate in place, the workforce has grown. There's no indication that if you have a vaccination mandate, you're going to have less healthcare workers. In fact, every indication is that you're going to have more. So I just don't understand. I mean, I could go through all the statistics during my testimony. I don't want to go through all of it. But what I don't understand is I haven't seen any evidence that the vaccine mandate has, it negatively impacted recruitment, negatively impact the spread of the disease. In fact, it's just the opposite. So I just don't understand why we're doing this. And again, base this on the science. Base this on the facts. Don't just say, oh, we'll get rid of the vaccine mandate because we don't need it anymore. Again, I don't think that's something that Congress should be doing. But I'm not going to go into it anymore, Mr. Chairman. I'll leave it at that.